Hey, what's up, guys? I hope you guys are doing pretty well. I'm personally doing fine, even if I technically was at school today and I had this exam, but I passed and I have a few left. You already know what the whole rigmarole or bandwagon, whatever the heck they call it, is when it comes to nursing school. Always got a exam every single week. But I'm done with this right now. We are currently doing, if I'm not mistaken, adulthood, and then we have to do human growth and development. So I just can't wait to be done with this whole term and then switch to or move to term three, and then I'll have two more terms before actually getting my license in August. Looking forward to that. So today it's a little weird because somebody did actually use the whiteboard and did find the whiteboard useful. I know it's crazy in itself, but hey, let's go and read that. So there's somebody said, I have bad news. I've been actually using my whiteboards in patient's room, and it's actually been helped. Oh my god, it's way too early in this video. I can't even talk right. Um, I've been actually using my whiteboards in patient rooms, and it's actually been helpful. It keeps me more organized and prevents some repetitive. I need to emphasize the some is all capitalized. Some repetitive questions from patients and family members. And this person also said, F people with offices are still the most annoying and don't have the right to tell me to use it though. I really don't know what the heck that was, but I kind of have an idea. So yeah, let's start. Well, when it comes to the whiteboard, like all patients' rooms has a whiteboard, and the things that they put on it is like your nurse name, the nurse leader name, um, a little nursing interventions and a little nursing actions as well, and some pending orders. Reason why I'm saying little, it's because I work on the med surg floor for the most part. Like the patients that we do get are clinically ill, or they have like chronic conditions or multiple chronic conditions which are being managed at the same time. So it's almost impossible for you to write every single thing that is happening, or the whole plan of care. That's what I was trying to look in my head. Like the whole plan of care of the patient. It's almost impossible to put in the whiteboard because that's gonna have any enough space. And sometimes, when you're giving report, I guess it's like the right thing to actually update your whiteboard as you're taking report and putting your names and updating like what it is that needs to be done. It could be the right thing to do it, and that's the only way, or maybe that's the only time I will. Honestly, if I was a nurse, I would have done it because I wouldn't actually go out of my way to actually fill that up because it's not one of those priority to a 12-hour shift, to be honest. But I guess it's like all a matter of like when you actually do it. But you gotta do it because if you don't do it, management sometimes they'll come early in the morning, they'll check the whiteboard, and then they'll select the whiteboard was not updated, and then they'll be talking about it, or they will just bring it up in the huddle. Which actually they have a point because patients have multiple questions and they needs to feel like hey they have control on what's happening for like on their stay, like on their care. So they need to know what's happening, which is totally valid because I don't want to be out of hospital not knowing what the heck my nurse is doing and why my nurse is doing something. But the whiteboard is not actually enough for you to actually put all the information that you got to put on there. But there's like some basic informations, for example, like hey, what's the next step on I don't know, like some not procedures, but I'll say what's the next step on something that might be monitored. So it is, oh, what are my lab values, or things like, what's my doctor's name? Because you're at the hospital, there's like multiple doctors that come in and out. So there's like some things that you really want to know as the patients, I think, and it does make it really nice for you or make you a really nice human being as a nurse to fill that out. But hey, sometimes it's just like how they do it and how they just on you gotta fill out the right board that just make it all like, oh please, I know I have to do it, but don't tell me, kind of thing you know and we are reading comments now. Somebody says, two things are true. It is actually helpful to put relevant info for patients and families on the whiteboard. And then the second point that she said was anyone who gets on your back not updating the whiteboard is a jerk. We all know that, hey, ain't nobody want to update the whiteboard, but it isn't necessary evil because patients will have these informations that they want to know for the most part. And that's pretty much it. But we also have patients who have 10,000 questions, and I'm sorry. It might feel a little bit insensitive. You're not the only patient at the hospital. That's all I'm gonna say. Somebody, I say somebody. Some people really feel like, hey, well, I totally get it, because you wouldn't be you're not at the hospital because you're at your best. You're at the hospital because you're at your worst, and you do have somebody who's taking care of you. Actually, multiple people's taking care of you, and I do get the fact that you might be a little bit overwhelmed, a little bit lost, and you're trying to get a hold on whatever it is happening around you. But having 10,000 questions at 2 o'clock, at 2 a.m., let me emphasize on the a.m., like early in the morning, ain't gonna be it. Ain't gonna be it. Knowing damn well that we went in the room and explained you every single thing, every single time you had the same questions. But sometimes you have to do it because some people might be, neurologically impaired, and then you have to say the same information over and over and over again, which is, totally understandable. But hey, this is one of the things too. Like some people might be like, why do I have to update the whiteboard knowing damn well like the whiteboard is there, the whiteboard is updated, my patient ain't gonna read it. That's a point. But hey, it is what it is. You're at the hospital. You're an employee of the hospital. You signed to be an employee of the hospital. Therefore, you need to abide to whatever policies they have. That's all I'm going to say. And the other comment says, I don't mind updating the whiteboard. I think it's helpful and useful tool for patients who are awake, heavy and awake, and with it for family members, for people who respond to say a bed alarm and want to know if my patient can get up to the commode with assistance or something. My problem is when management, everybody, I'm not gonna say what I really wanted to say. Except me to prioritize over the task. That's what I'm saying. Like, anybody can prioritize you over like, hey, you got to take the whiteboard. Like, for example, you come right, you are the nurse. You have 6 patients, 7 patients you're taking care of, right? And then there's a 6 patients. There is 6 whiteboards. So 7 patients, there's 7 whiteboards. There's no way in hell that hey, you're gonna go through every single thing that you have to do like on every patient charts and upload the whiteboard, because like somewhere there's information of the whiteboards and that information that you can just open and then you will see it flat out. Like you might get some information like the patient's name, some doctors are following them, but you'll also need to dive a little deeper on each patient chart to actually put the relevant information on the whiteboard, because why put other informations that are not really relevant, because the whole point is having something that is relevant that they can reference to, right? So it does not really make any sense, because what if I come, I have 6 patients, and then boom, as soon as I clock in, there is an emergency on the floor. Am I gonna really go back and update each whiteboard? I ain't gonna go back and update each whiteboard, or I ain't gonna really be thinking about updating each whiteboard. I would if I'm giving him meds and I have like some time off in between. Like, hey, I'll be in the room, therefore the chart is open in front of me. I need to make sure that the patient is, swallowing the medication. I'm not gonna leave the room, or I monitor something. I'm in the room for like 10 or 15 minutes. I can find some time to update the whiteboard, but it's not gonna be like one of those like top priority things that I absolutely will be thinking about doing. And there's also a little shame that comes to it, because some people will shame you with like, oh, you never updating your whiteboard, and you kind of like make like whole shame, unnecessary shame stuff, but out of it, which I'm like, really? Out of everything that I've done tonight, is that like the priority? Is that the only thing that you really have to tell me? You ain't gonna tell me like, hey, I have a good night, I have a good sleep because I work night shift, but you're gonna tell me like why I didn't update the whiteboard. It's not one of those things. The last comment that I will read says, I don't mind. No, I already read that. So it's from a CNA. So the CNA said, I work with dementia patients. They just hit the call light a dozen times to have me read it to them. And if I accidentally call their attentions to it, what's gonna happen then? Oh no, this wasn't complete. And they can read a name, they will scream that name. Oh yeah. I was like this. Oh my god. That's what I'm saying. Some people are neurologically impaired. Therefore, you will have to be a little bit more patience with them. And there is some stuff that you can just expect that you'll have to do it over and over and over again, like going to the room and update this whiteboard, or let them know like, hey, what's on the whiteboard, because they might not be able to read it, or they might not be able to understand it, or I'm just not making sense for them. So I guess. But I don't understand both sides, right? Like you have the nurses out like, I have multiple things to do. The whiteboard is like the list of my priorities, but I also do understand management, because the main reason why we have the whiteboard in the room is to allow the patients have a sense of, I'm not directing, but I have a say on my care, I'll say, or I kind of know what's happening. even if there's like so many things that happen at the hospital so fast that it's almost impossible to just record and report everything on the whiteboard as they're happening. And yeah, so when a patient's call multiple times to actually get an update on whatever it is they might have going on for them. So I do understand sometimes it might take a little time for wherever is on the floor available to come in the room and actually go to the chart and explain them whatever it is they're actually going through. But having the whiteboard updated would have just, avoid the whole like, hey, having somebody to go in the room because the patients already know the whiteboard is there. The whiteboard was already explained to the patients. The whiteboard is being updated. Therefore, like the amount of questions or the questions load will technically be less because they know what's happening. And that's the whole point of the whiteboard. That's with patients who are able to read the whiteboard and understand it. But you also have patients who cannot read the whiteboard and understand it. And there's might be a little more things that will involve, you taking care of those patients, like going back in the room and tell them like, hey, this is your whiteboard, this is what on it. Even if you technically have to do like 12 or maybe 15 times throughout the night, I guess that's one of the things to do because it's of course like one of a part of the job because that's one of the patients you have. And that's one of the things that they require to, properly take care of them. Because that, if you don't do it, they'll be yelling your name. They don't want somebody to be yelling your name for the next 12-hour shift. For the next 12 hours while you're in your shift. I don't want that. Therefore, I'm gonna go in the room and update them maybe periodically every 30 minutes or 45 minutes if I have time. And I'm saying if I have time because I'm not a nurse, but I do see like how busy the floor can get sometimes. And the whiteboard is really, honestly, not a priority for the most part, but it can be well, it's just a tool. Use it. Use it when you can. That's all I'm gonna say. Because I know not all the time you can use it. That's all I'm gonna say. Thank you for watching. I hope you guys are doing pretty well. And I'm pretty back to be with you guys. I have not felt my best like for the past 3 or 4 days, but now I'm not feeling totally great, but I know life is good and I'm pretty grateful for whatever it is I'm have right now. So I'm just like, let's just record. And that's what I'm doing. So yeah, I like talking to you guys. I will see you guys in a few, and you guys have a good day. Bye.